So are we ready? Marie, are you ready? Yeah, and good morning, everyone. Yeah, I hope everyone can hear me. No? Yeah, so for this morning's lecture series, no, on basic emergency, lay fora, we will be tackling about very common symptoms, no, which is abdominal pain. So for today's lecture, I would like to introduce our resource person. She is a graduate of the St. Luke's Medical Center Surgery Residency Training Program. She also served as the chief resident, when she was in her senior residency. She is an active consultant both in St. Luke's Global City and St. Luke's Quezon City. So without further ado, I would like to introduce to you Dr. Marie Abigail Chan. Marie, go ahead.
Good morning, Dr. Adora. Thank you very much for that introduction. Yes, good morning to our audience as well. I am Dr. Marie Chan, and our topic for today is about abdominal pain. So as an overview, abdominal pain is a very common problem, and the most common cause is usually benign or self-limited. Most of us experiences an upset stomach, indigestion, hyperacidity, gas pain, bloating from overeating, and stomach viruses. These conditions are usually a little cause for concern, and it is often possible to treat these symptoms safely at home. Although abdominal pain is usually benign, the initial goal of evaluation is to identify those patients with a serious cause or illness that may require urgent intervention or bringing the patient to the emergency department. So I will be showing you a pre-recorded video prepared by the Institute of Surgery of St. Luke's Medical Center. In this video, we will be discussing some of the most common causes of abdominal pain and how to manage some causes of abdominal pain at home and to know when to seek consult. So feel free to write your questions in the chat box and I will try my best to answer them after the presentation. So before anything else, I would like to remind everyone to please like and subscribe to our Facebook page and to our YouTube channel. So I will now play the video. Hello, can you see my screen?
Yes, Marie, we can see your screen.
The video, sir. Can you see it?
Is it playing?
Here. This is your time. Okay. Wait.
Are you playing the video, Marie?
Not yet, sir. It's stopped.
Okay. So before you play the video, I would like to remind everyone, that we are streaming live in YouTube. So please don't forget to subscribe and like our YouTube St. Luke's Medical Center YouTube page. And if you have any questions regarding the video, you can directly type it in the chat box for us to answer. All right. Are you ready, Marie?
Yes, we're ready, sir.
All right. So maybe we can play the video.
Does your tummy ache? Welcome to St. Luke's Medical Center Laguna Forum. In this short video, we will talk about what you need to know about that abdominal discomfort. What is abdominal pain? Abdominal pain is discomfort or other uncomfortable sensations that you feel in your belly area. Just about everybody at one time or another will get a belly ache. Most causes of abdominal
Marie?
Hello?
Hold on. No? Yeah, hold on. I think the audio is
Hello?
not working. Yeah, Marie, can you hear me?
stomach virus, or if you're a woman, menstrual cramps. Here are other possible causes of abdominal pain. It is a mix of major and minor causes, hence the importance of early consult. In the general population, one of the most common causes of abdominal pain is indigestion or gastroenteritis. On the other hand, the most common surgical indication is acute appendicitis. Symptoms of these illnesses are usually similar, and sometimes a delay in consultation may happen. Both of these illnesses have the following symptoms: abdominal pain, fever, nausea and vomiting, and generalized weakness. Given the similar presentation of the two diseases, how do you know which one is which? Another important question is that when is the right time to consult with your doctor? Major differences between viral gastroenteritis and appendicitis are the profuse watery diarrhea associated with cramp, intermittent abdominal pain inconsistent in location in gastroenteritis, versus the much more severe, progressive, and persistent abdominal pain that usually localizes to the right lower part of the abdomen in appendicitis. In addition, viral gastroenteritis is often associated with the previous or ongoing respiratory tract infection. Most cases of acute gastroenteritis can be managed conservatively at home. To do this, take note
Marie, I think we're having a technical issues no, regarding the sound.
Hello, sir. Yes, opo.
We're having technical issues no, regarding the sound. Can we check again? I think
Yes, sir.
we
I'll try to
have,
play it again. It's a
we
short
have
video lang
yeah, I
naman.
think we
Opo.
have omitted a lot of
Yes,
information.
sir.
Yeah, can we
At,
check again?
yes, sir.
Thank you.
Can you hear me?
Yes, Marie, loud and clear. I think
Hello?
yeah, Marie, we can hear you. I can hear you.
Sorry for the technical problem. Wait, I just tried to fix it, sir. Hello?
Yes, Marie.
Hello, can you see my screen?
Yes, Marie, you can see your screen.
Okay, I'm going to play the video again.
Does your tummy ache? Welcome to St. Luke's Medical Center Lay Forum. In this short video, we will talk about what you need to know about that abdominal discomfort. What is abdominal pain? Abdominal pain is discomfort or other uncomfortable sensations that you feel in your belly area. Just about everybody at one time or another will get a bellyache. Most causes of abdominal pain aren't reasons to worry, and your doctor can easily diagnose and treat the problem. Sometimes, though, it can be a sign of a serious illness that needs medical attention. There are several types of abdominal pain which are based on how quickly your pain starts and how long it lasts. Acute pain starts over a few hours or days and may come with other symptoms. Chronic pain, on the other hand, lasts longer, from weeks to months or more, and may come and go. Progressive pain is the type of pain that gets worse over time and often comes with other symptoms. Whether you've got a mild ache or serious cramps, abdominal pain can have many causes. For instance, you might have indigestion, constipation, a stomach virus, or, if you're a woman, menstrual cramps. Here are other possible causes of abdominal pain. It is a mix of major and minor causes, hence the importance of early consult. In the general population, one of the most common causes of abdominal pain is indigestion or gastroenteritis. On the other hand, the most common surgical indication is acute appendicitis. How can you tell whether you have acute appendicitis? What is the main difference between acute gastroenteritis versus acute appendicitis? Symptoms of these illnesses are usually similar. Hence, sometimes a delay in consultation may happen. Both of these illnesses have the following symptoms: abdominal pain, fever, nausea and vomiting, and generalized weakness. Given the similar presentation of the two diseases, how do you know which one is which? Another important question is that when is the right time to consult with your doctor? Major differences between a viral gastroenteritis and appendicitis are the profuse watery diarrhea associated with crampy and intermittent abdominal pain inconsistent in location in gastroenteritis, versus the much more severe, progressive, and persistent abdominal pain that usually localizes to the right lower part of the abdomen in appendicitis. In addition, viral gastroenteritis is often associated with a previous or ongoing respiratory tract infection. Most cases of acute gastroenteritis can be managed conservatively at home. To do this, take note of the following. It is important to keep good hydration by increasing oral fluid intake. For fever episodes, over-the-counter paracetamol can be taken. Do bowel rest if with episodes of vomiting. If able to take in food, may have small, frequent meals. Adequate bed rest is also necessary while the body is fighting the infection. Call your doctor immediately if you are experiencing symptoms such as multiple episodes of profuse watery diarrhea associated with vomiting, signs of dehydration like less frequent urination, more concentrated urine, inability to take oral hydration, and severe generalized weakness. These are symptoms of severe acute gastroenteritis that require prompt medical attention. If you are suspecting that you might have acute appendicitis, go over the following questions. Did the pain initially start somewhere on the belly, but eventually migrate to the right lower abdomen? Pain doesn't go away? Feeling nauseated or had episodes of vomiting? Experienced accompanying loss of appetite? Pain on the right lower abdomen upon pressing? Feeling feverish? If your answer is yes to most of the questions above, you may have appendicitis and it is best to seek medical consult right away. Remember that there are other possible causes of abdominal pain. However, if the abdominal pain is serious, doesn't go away, or keeps coming back, talk to your doctor. You should also consult with your doctor as soon as you can if you have symptoms along with the pain such as no bowel movement for days, pain when you urinate or you urinate often, abdominal pain even in slightest movement, unexplained weight loss, vomiting blood or vomiting frequently, notice bloody or black tarry stools, have trouble breathing, or have yellowish skin, tea-colored urine, or light-colored stools. Of course, these are just some of the more common complaints. The list goes on. But for the most part, if you are unsure of your current well-being, seek medical consult immediately. Lastly, remember to hydrate always, eat healthy, allot time for exercise, and consult as needed. Thank you and have a nice day.
So that's our video. That's the presentation prepared by St. Luke's Medical Center Institute of Surgery about abdominal pain. So do we have any questions from the audience?
Yeah, thank you, Marino, for a very interesting video. Very informative also, no, for our audience. So to our audience, if you have any questions, you can type it in the chat box. No? So do you have any questions to Dr. Chan? So I think I'll have to start, no. So Marie, according to the video, no, I think the most important takeaway or take-home message is when to seek consult, no. Yeah, one of our audience actually asked the question: when should you seek medical attention for diverticulitis?
For patients with diverticulitis and having abdominal pain, if you already know that you have diverticulitis as your medical condition, you have to talk to your doctor if you have abdominal pain, fever, abdominal distension, or persistent abdominal pain that is also associated with bloody stools or symptoms of obstruction such as abdominal distension or no flatus for a few days or no bowel movement for a few days. I think you have to seek consult,
Thank you, Marie,
medical
no?
consult.
Yeah, so I think the most important thing here is the severity of the pain. No? Usually you can um, uh, quantify, the severity of the pain, being 0 to 10, 10 being the most painful. If you I mean, the pain is actually a subjective complaint, no. So only the patient can actually quantify, the pain. So if you have a very severe pain, I think that's the time you seek consult, or you go to the emergency room or to the doctor's clinic to seek medical attention. Okay. So do we have any more questions? So there's another question here, normally. In the case of unclear reason of abdominal pain, since no consultation yet has been done, what is the applicable first aid to ease the pain?
About abdominal pains, what is the applicable first aid, if any, to ease the pain? So first you have to know the location of the pain, or you have to specify the location of the pain, because the location of the pain will actually tell us the differential diagnosis of the possible causes of your abdominal pain. So if it's like at the epigastric area only, it may be due to indigestion or acid-related disease. If you have those conditions, you have to avoid triggers. You can place hot compress. You can take proton pump inhibitors or Buscopan for those kinds of situations. But if you have persistent abdominal pain, you have to seek consult with your doctor.
Yeah, so thank you, Marino, for the answer. There's another question here in the chat box. When is the time that over-the-counter meds, or medication for abdominal pain is contraindicated? Example, antacid and antispasmodic.
Sir, sorry, nawala po yung audio. Can I have the question?
Yes, so the question is, when is the time that over-the-counter medications for abdominal pain is contraindicated? For example, antacids and antispasmodic.
For antispasmodics, you can seek consult first before taking it. And for antacids, because some antacids can have complications, or some PPIs, if taken for too long, some proton pump inhibitors such as omeprazole or esomeprazole, if taken for too long, can actually cause complications. So you have to seek consult before taking any medications. Especially if you're going to take it for a long period of time.
Yeah, Marino, you're right. No, you're correct. No, I think also for some patients, like antacids and antispasmodics, sometimes they have it as a maintenance medication, especially if they are diagnosed with acid-related disease or yung merong ulcer, diagnosed previously. So again, whenever you're in doubt, or the severity of the pain, is like very severe, that's the time you can seek consult, but if you can still tolerate the pain, I think if you have a previous history of ulcers or acid-related disease, you can actually take the antacids, okay? Especially if you're taking it even before or previously, because of you were diagnosed with, for example, peptic ulcer or acid-related disease, okay? Another question here is what type of pain on the right side back of lower back torso? So I think our audience is asking about the symptoms. What can you say about the pain when it occurs in the right side, back, or the lower back torso? Marie?
Actually, for abdomen, it's located at the flank, right side, back of the lower torso. So again, as I've emphasized earlier, we have to be specific at the location of the pain, and then next we have to determine the severity of the pain, the onset of the pain, the frequency of the pain, and usually if it's on the right side or left side back, we usually can attribute it to causes from the kidney disease or kidney stones. We can also consider intestinal causes from constipation, fecal stasis, etc.
Yes, thank you, Marino, for the answer. So another question, on and off pain on the upper right quadrant, burning sensation at times, pain after eating fatty foods for months, normal result upon ultrasound, probably cause po kaya. So I think they are asking anong pwedeng mag-cause ng pain dun sa upper right quadrant daw with the burning sensation at times. Pain after eating fatty foods for months. But with the normal result upon, I think this is a whole abdominal ultrasound our audience is asking.
Okay, we for patients who have on and off pain on the right upper quadrant with burning sensation, we first usually consider or pain after eating fatty foods for months, we usually consider a gallstone disease. But if you already have a normal result upon ultrasound, I guess you have to observe for a while or maybe consider other causes such as acid-related disease because of the burning sensation. And also, you can seek consult with your gastroenterologist to do an endoscopy to check if you have an ulcer or gastritis.
Yes, correct, Marie, you're right. Actually, there's a lot of causes. The most common cause is actually an acid-related disease, which can cause also these symptoms. Okay, so if you have a normal ultrasound, without any gallstones, and still you have on and off right upper quadrant pain with burning sensation, most probably you have a acid-related disease or a ulcer, stomach ulcer. Another question here, Doc, ask ko po kung ano pwede gawin pag sumakit yung tagiliran. I need po ba pa-lab exam? So I think tagiliran means flank, flank pain. So hindi niya ni-specify which side, basta sabi niya tagiliran daw. So Marie?
Okay, usually kapag sumasakit yung tagiliran, kailangan alamin kung gaano nakatagal yung sakit, kung paulit-ulit ba ito. So if paulit-ulit na, I think kailangan niyo po magpa-check up. Yung lab exam will be determined by the doctor who will be seeing you. So depende po sa physical examination. So we have to check muna before kami magbigay ng mga laboratory exam request po sa inyo.
Yun, tama, so usually pagka magpapalab exam kayo, kailangan niyo ng request ng doktor. So depende rin dun sa assessment ng doctor kung anong ipapagawa niyang mga laboratories sa inyo. It's better kung yung pain, it doesn't go away, parang very chronic na siya, I mean on and off, tapos minsan it's very severe, that's the time you seek consult also with your doctor, okay, for additional diagnostics or additional laboratories. So another question here, Marie, would abdominal pain in pregnant patients always be an indication for consult?
Okay, for pregnant patients, of course, it's always a cause for concern or worry for the mother if you are having abdominal pains, kasi it may be because of contractions or maybe a UTI or infection. So it's best to ask your OB to make sure na wala po tayong problem with the pregnancy or the baby.
Yes, no, always check with your OB, no? Kasi minsan yung ibang gamot hindi pwede sa mga pregnant. Okay? So usually dapat may clearance with OB. Okay? Lalo na with abdominal pains, no? Another question here, Marie, had my checkup and ultrasound done at St. Luke's, Quezon City. Walang nakita but the pain is persistent. It's been like 7 months na do. So usually pagka ganito, we need additional information, no, para lang ma-check namin kung ano yung source o saan nanggagaling yung pain. Okay, so Marie, can you comment on this?
Yes. If nakapag-check up na and ultrasound was done, yes, tama, I agree with Dr. Adora, because we need to do additional imaging tests or additional lab tests to determine the real cause of your pain. We also have to examine the patients in the clinic para ma-check up kayo maigi bago tayo makapag-conclude kung ano po talaga yung sakit po ninyo. Especially kung ganyan, persistent na yung pain for 7 months. So that's a very long time already. So we have to look for the cause of your pain.
Yes, so kailangan po natin ma-determine kung ano yung nagko-cause ng pain, no? So in order for us to do that, no, we need a thorough history and physical examination, as well as additional laboratories, no, kung walang makita on ultrasound. Okay? Maybe we need to do like additional tests like endoscopy, no, or additional tests like CT scan maybe, no,
Yes.
for us to determine kung ano yung nagko-cause ng pain niyo po. Okay? So, are there any more questions from the audience? Yeah, I think ang daming nasagot natin na questions na regarding abdominal pain. So, just remember, no, when you're in doubt, no, or the pain is very severe, no, gaya ng sinabi ko kanina, when you quantify the pain, you need to seek medical advice or medical attention, no, immediately. Kaya ang present ng Institute of Surgery is regarding abdominal pain, maybe the cause of the abdominal pain is surgical. Ibig sabihin, kailangan kayong operahan, no? Yun yung cause ng pain, gaya nung kanina dun sa video, sinabi na ang very common, no, na cause ng abdominal pain o severe abdominal pain, unang-una yung medical, which is gastroenteritis, no? It's very, very common. Second is acute appendicitis, no? Baka mamaya acute appendicitis pala yung pain. Very, very similar kasi yung kanilang symptoms, no? Yung acute gastroenteritis and acute appendicitis. So, pagka ganon, depende dun sa severity ng pain, no? So, if it's really severe, so I think that's the time that you can seek consult, no? Sa emergency room or sa doctor's clinic, no? To have a proper medical advice. Okay? So, Marie, do you have any more
Yes.
take-home message for our audience before
Yes.
we end this day for? Thank you.
Yes, I would just like to add, I agree with Dr. Adora, but also, for example, we have patients coming in with epigastric pain and then iniisip lang nila na gastritis lang yon, acid-related disease lang yon, but it will actually turn out to be heart attack. So may mga pain na, especially for patients with other comorbidities such as hypertension, obesity, diabetes. So you have to be cautious. Huwag niyong i-downplay yung abdominal pain. You have to seek consult immediately. So for my take-home tips, Number one, while most common causes of abdominal pain can be managed at home, if you are unsure, it will be best to seek consultation or at least talk to your doctor. Doctors are responsible for trying to determine which patients can be safely observed at home or treated symptomatically, and which would require further investigation or referral to a specialist. So number two, do not delay management. Go straight to your doctor or the emergency department if you have any of the following symptoms: severe pain, pain lasting for several hours, pain and vomiting or shortness of breath, pain and vomiting blood, blood in your stool or urine, pain that spreads to your chest, neck, or shoulder, fever and sweats, you become pale and clammy, unable to pass urine, unable to move your bowel or pass gas, pain and or vaginal bleeding if you're pregnant, pain in your scrotum if you are a male. So you have to go to the hospital or emergency department at once. And number three, you have to eat a healthy diet, drink enough water, and avoid triggers or precipitating causes as much as possible. So that's it. I hope you learned a lot today. Thank you very much.
Yeah, thank you, Marino, for being our resource person for today's Lay Fora. So thank you also to our audience. No, don't forget to subscribe to the St. Luke's YouTube channel. No, please subscribe, like, no, and also our Facebook page. All right. So thank you, everyone. See you again next time. Okay. Bye.
Thank you.